Rule 12. With prescribing, if any errors or questions arise, consult these people in the given order. First of all, the prescribing doctor, then another senior doctor on the ward or in the team, and then lastly, a pharmacist. This is the order you should be going in. This is because although the pharmacists are very knowledgeable and it is their specialty, um, the prescribing doctor should definitely know about any problems or concerns coming up with his prescriptions for his patients. He might be more knowledgeable. He might be using things for off-label use or in different doses than normal. And there should always be clinical correlation when prescribing medicines to a patient. So the prescribing doctor is number one. Then another senior doctor would be appropriate because, again, we still need that clinical correlation. And then lastly, you can approach a pharmacist for the question. So now let's move on to the question. Your consultant, Dr. Jackson, has asked you to prescribe a second antibiotic for a patient who has a chest infection, which has been slow to respond to initial treatment. Later that day, a pharmacist informs you that the new antibiotic is not in the hospital formulary. She tells you that the new antibiotic should not be used because of the risk of Clostridium difficile infection. Rank the appropriateness of the following actions. Pause and then let's discuss. So the answer is C, B, D, A, E. So C would be the most appropriate because you are agreeing to contact Dr. Jackson to discuss the prescription yourself. You are the FY1, you are responsible, he is your doctor, your consultant, and it would be most appropriate for you to go back to him and discuss the prescription with him because he is the prescribing doctor. The next option would be B, which is to explain that Dr. Jackson had requested the antibiotic and he would be the best person to speak to about the prescription. So here you're telling the pharmacist to contact your consultant. It would be better if you had done it. It's not the pharmacist's job, but it would be the next most appropriate option. Next is D, to ask your specialty trainee to review the patient to enable an informed decision. This is great because as I said in the rule, first of all, you want to go to the prescribing doctor themselves. Next, you want to go to another senior doctor in your team or on the ward. And so to go to your specialty trainee to review the patient and make a decision which is clinically informed as well would be the next best option. Lastly, you have to choose between A and E, to prescribe what the pharmacist advises or to not change the prescription and make a record in the notes. So prescribing what the pharmacist advises is fine, but again, there's no clinical correlation. So you'd first want to go to the prescribing doctor, then another doctor, and then go with the pharmacist's recommendation. So that's what this ranking here suggests. And then E would be the worst because when you've actually noted something in the notes, you haven't informed anyone in the team, you don't know who's going to read the notes, the patient isn't getting the medicine, and you haven't given any medicine at the end of the day, and this patient needs another medicine because they haven't been responding to the initial treatment. And so this would be the least appropriate option here. You can pause and read the rationale now. Keeping with the theme of prescribing, rule number 13 is that when you're making any decisions involving medications to be prescribed, you want to first go to the local guidelines, then you want to go to the BNF, and then you want to go to the national guidelines. This is the order that is most preferred. There are questions in the papers that have these in order, and this rule applied. We're not going to discuss it. We're going to move on to the next one, but just keep in mind, as it was for prescribing with the doctor, you want to go to the prescribing doctor first, then another doctor, and then last option is pharmacist. Same with the medications. You want to go to the local guidelines first, then the BNF, and the last option is the national guidelines.